I'm not going to spend any sort of chunk of time trying to convince you of the benefits of digital technology in health and social care. Instead, we'll focus more on a bit more of the practical, how do you do it once you're convinced of that, especially if you're a little bit further behind and if you're interested in doing some what we call large-scale technological change. Electronic patient record, embedding mobile working, providing remote access to services, that sort of thing. So these are the themes that we ultimately reduced everything down to. Leadership and management, user engagement, information governance, partnerships, resourcing and skills. I'm starting with leadership and management. The most important barriers to success that we found were concerns and anxiety born of historic struggles with IT in the NHS. So some of the legacy of NP Fit, some other issues that people have had around actually delivering a lot of the benefits that they were promised. Local areas also used the right leaders at the right time. It wasn't always the most senior person in the room who took charge of whatever project was being discussed. Leaders were also motivated by outcomes other than immediate cost savings. A lot of you will understand that the cost curve and the return on investment is not immediate. In fact, there's a significant initial cost, and you're not likely to see significant productivity return for several years after that, if not longer. But if there's one big thing that I can highlight more than anything else that I say, don't see implementing technological change as an IT project. It is a clinical change which uses technology. Information governance. Yes, it can be a very fraught process, but it can be a tremendous trust builder. It's something that if you get it right in the early stages, you start establishing relationships that pay off further and further down the line, and that also let you do more with what you initially set up. And there is a bit of, again, intimidation around some of this, but a lot of our sites found that they could get through this through dialogue, through working carefully and slowly together with a clear set of objectives.
Cases focused on digital clinical tools. So most users were clinicians, but it's not all of them. Done badly, engagement can feel like rubber stamping and can sow the seeds for low adoption rates or implementation problems. To do it well, we heard that it should be done early. We heard about a spectrum of attitudes towards change, and we constantly hear like, how can I bring my colleagues with me? How can we make sure that we develop that enthusiasm in the rest of the workforce? And so this cultural gap between tech enthusiasts and technologists, people who build the technology that we're deploying, has to be overcome. And the clinical leadership that David talked about before is also essential in building strong user engagement processes. The final thing we heard about user engagement is it's important to make sure you don't deploy or you try to avoid imposing fixed solutions as much as possible. This fourth area is about partnerships between the NHS and technology organisations and suppliers. We heard some concerns about competition between suppliers that led to some awkward technical solutions and about unrealistic implementation timelines. But to counter all of these issues, lots of sites had put in place real efforts to build relationships with their suppliers and directly facilitating this conversation between users and their suppliers and partners. They also recognised that the suppliers themselves are experts in digital change management processes. They've been through a lot and are learning all the time, and finding a way of tapping into this and informing their plans in their local areas early enough was key to positive relationships. And so the final kind of fifth area that we looked at was resourcing and skills. And the current pressure means digital projects can be driven by short-term concerns a little bit. And I think that's a worry because a lot of these technologies are part of long-term complex digital change. Digital transformation is about more than financing. It requires organisations to have the right people, assets and skills, and a clear and adaptable plan. Case studies invested in their people, equipping them to support technological change and motivating them to take challenges seriously. And finally, this may not surprise you, but from an organisation like ours, we're really interested in how you evaluate these technologies. So what next? We'd like you to read it. As I said, there's loads in there. There's 80 pages worth of people's stories and our analysis and a flavour of the literature on this kind of change. So hopefully we've given you a flavour of these high-level findings.